Good afternoon, everyone, and thank you for joining us today. My name is Samantha Batko, and I'm a Program and Policy Analyst at the National Alliance to End Homelessness. I'd like to welcome you to today's webinar on improving the crisis response for youth. Joining me today are Kristen Granatek from the Connecticut Coalition to End Homelessness and Mark Kroner from Lighthouse Youth Services in Cincinnati. Before we get started, I want to touch on a couple of logistical points. The PowerPoint presentations for both of our presenters are posted online. The link has been sent out to all webinar participants and should be in the chat box of your webinar dashboard to the right-hand side of your screen. All of the lines will be muted throughout the webinar. If you have questions at any point, you can send them to us through the webinar software. Please type them into the chat box labeled questions on your webinar control panel, which should be located on the right-hand side of your screen. If you are listening on the computer and having audio trouble, I would encourage you to call in on the telephone. There are approximately 200 registrants for this webinar, and with that many people, the audio quality is generally better on the phone. We will have time at the end of the webinar to answer many of your questions. While we'll do our best to get to as many of them as possible, we will probably not get to them all. For those questions that we do not get to today, we will follow up after the webinar. Also, please note that a recording of this webinar will be posted on the Alliance website as soon as possible, and the link to the recording will be emailed out to all registrants of the webinar. Now, we'd like to get a feel for who we have on today's webinar in our audience. So I'm going to launch a quick poll question, which should be popping up on your screen momentarily. We would like to know if you are currently providing emergency housing for youth, and if yes, what age group you are primarily serving. Now, I understand that you may fit into one or more of these categories. Try to pick the category that best fits your program, and you might have other programs in addition to it, but the one that you feel like is the best representation, just so that we have a feel for who we have on the call. I'm going to allow about 10 more seconds for answers to come in. Okay, great. Thank you. And as you should be able to see the results of the poll now. And you'll see that the majority of you that answered, about 40% of you are doing something other than our options, so maybe our options weren't that great. But then we have about an equal breakout between the large portion of you are not currently providing emergency housing to youth but are interested in doing so, and that you're currently providing emergency housing for those under the age of 18, and then you have some that are providing for both 18 to 24 and under the age of 18. So thank you, everyone, for participating in our poll. Before we move on to the presentations by our guest speakers today, I'd like to take a little bit of time to lay some groundwork for our conversation today. First, the Alliance estimates that over the course of the year, there are approximately 1.9 million youth under the age of 25 who run away, are thrown away, or are homeless for any period of time. The chart on this slide shows a rough breakout of those youth. Approximately 1.3 million of those youth under the age of 18 return home very quickly and likely with very little or no assistance. And that leaves approximately 550,000 unaccompanied single youth and young adults up to age 24 who experience homelessness and may be in need of emergency housing or other services. Of those 550,000, about 450,000 are homeless for a very short period of time and probably do not have multiple episodes of homelessness. An additional 80,000 are repeatedly or chronically homeless. And lastly, there are approximately 50 to 60,000 families that are headed by a young parent. Currently, we estimate that approximately 150,000 of these unaccompanied youth are being sheltered by the adult individual homelessness system every year. And just over 40,000 youth under the age of 18 are being sheltered by the Runaway and Homeless Youth Basic Center programs over the course of the year. And if you can do quick math, you'll see that this leaves a very large number of youth with nowhere to turn for crisis housing. And we know that there are thousands of turnaways from Runaway and Homeless Youth programs annually. And based on street counts in some cities, we know that there is a population of youth who are living on the streets because they don't have anywhere else to stay. And there are also youth that are making perhaps unsavory living situation decisions based on the fact that they have nowhere else to stay as well. This webinar is going to focus on how we can create alternative crisis response programs that have flexible capacity and that the physical buildings do not have, as well as how we can make the adult shelter system safer and more effective for youth that are staying in it. As we listen to today's speakers, I'd ask you to key in on some of these aspects that we hope to achieve with an adequate crisis response for youth. The first is that it should be accessible, meaning that ideally we have the capacity to serve all youth who need crisis housing. We know that that is not currently the case, but today's webinar is focused on developing some innovative ways to help create that capacity. Also, accessibility means that there are not too many hoops or rules for youth to jump through in order to get into crisis housing, meaning that these programs should be low barrier with an ultimate goal of keeping youth off the streets and safe. Which brings us to our second point, that programs that are providing crisis housing for youth should be safe. Particularly in the adult shelter system, youth have reported not feeling safe in these programs and therefore are not accessing them and are choosing to live on the streets or in other dangerous situations. Lastly, the crisis response for youth needs to be focused on positive youth outcomes, meaning that while the adult homelessness system and the family homelessness system focus primarily on rapid placement into housing, programs that are also serving youth and young parents should be looking at family intervention options and seeking reunification with family, be that an immediate family member, an extended family member, or another positive adult figure in a youth's life. This family work is already a focus of the Basic Center programs for youth under the age of 18, but should be spread to the adult and family homelessness systems in order to create an enhanced homelessness system that is more responsive to alternative positive exits for young adults. With that said, I'd like to introduce today's first speaker, Kristen Granatek. Kristen is the Manager of Technical Assistance and Program Services at the Connecticut Coalition to End Homelessness. Today, she is going to be discussing the development of a Basic Center program that uses a host home model as opposed to a physical shelter building. Kristen?
Hi, everyone. Thank you for inviting me, Samantha. I certainly appreciate the opportunity to be here. I am just trying to get my slideshow up. There it is. So before I joined CCEH in April, I was actually for 4 years the director of Project Reach and Shelter Services, which is part of Women and Family Center, a nonprofit in Meriden, Connecticut. And we had for many years a street outreach program for runaway and homeless youth that served kids ages 13 to 21 in our area who were in need of shelter and supports. And the way that we were really providing those services was by making contact with them on the street and seeking them out to provide services really where they were at their level. And of course, one of the things that we did was when we found kids who were runaway and homeless was to seek out shelter for them and to work with them on meeting those basic needs, making sure that they had a safe place to stay. Towards the end of my time with WFC, we actually got funding from ACF for a Basic Center program. So that funding started last October, and in the last 6 months of my tenure at WFC, I started up our youth shelter and actually saw it launch just 2 weeks before I left. So that's what I'm going to talk to you about today, is really the need that we looked at, why we chose the model that we did, and what that process was like for us in terms of some of the logistics and things that went along with our youth shelter. So the first thing that was really critical for us was to know our community and to know what was happening on the ground and really look at the needs. When I came on board with WFC, what was crystal clear to me was that not having a shelter was an incredible gap in the service system. We had a great street outreach program. My staff were really well known in our community. Folks kids knew who we were. They felt comfortable with us. We were making contact with a lot of kids. We were finding a fair number of kids who were runaway and homeless every year. And yet the big missing link was that we didn't have a shelter of our own to put them in. What we were doing was, if they were old enough, if they were over 18, of course, we were referring them to the adult shelter system. If they were under 18, we were making referrals to DCF, Department of Children and Families here in Connecticut. Sometimes those referrals were taken, sometimes they weren't. If They weren't taken particularly for the 16 to 18-year-old or 16 and 17-year-old population. Then we were really looking at finding an alternative for them. Sometimes that meant finding a way to reconnect them with their family if that's what they were comfortable with. Sometimes it meant looking for an alternative placement. And then, of course, we were looking to the other youth shelters in our area. The great difficulty with that was that until WFC's program launched, there were only 11 beds in the whole state of Connecticut that weren't connected to VCF. Those beds were in New Haven, which is about a half an hour south of where we were, and then there were a handful of beds in the southwestern corner of the state. Always full or frequently full, which was one barrier, and certainly not local to our kids who were wanting to stay connected to the services and supports and their friends and sometimes their family members that they had around them. So it really was a huge gap, as I said, in the service system. So that was one need, was just for our own shelter, given that there wasn't one in the community. So we looked at that. We looked at the numbers of kids that we were serving every year, the services that were available to them in terms of what we were providing, the success that we had had in engaging those kids and reaching out to them, what other services and supports were available in our community, and then what the unmet needs were. We also, in planning for a shelter, and it was quite a long process, I think we probably spent over a year really considering what we might do when ACF presented a basic center funding opportunity to us, and how we might build a shelter program. We really looked at, what else was happening in our community. I worked with the 10-year plan in Meriden and Wallingford, which was the primary community that we were involved in, although ultimately that shelter served a broader service area of 19 towns. But I did spend time on the safety net committee and working with the other 10-year plan committees, just having an awareness of, what are the other services? There was an adult shelter, there were other service providers for domestic violence, that sort of thing, that had shelter, but we needed to know what was happening on the ground and what were the other gaps in services, what were the other services that could support our plans to open a shelter, and then how would that fit into our 10-year plan. We did not work with a continuum of care in our community necessarily because that community was part of the broader statewide balance of state continuum of care, but if you are in a community that has an active continuum of care, it's one of the things that I would really strongly recommend is to get involved with your continuum of care and with your 10-year plan and really know what's happening and be connected to those systems. I think the next step in our process, aside from knowing what was happening on the ground, is really community engagement. This became critical to us. I know that even after I had opened my shelter, and certainly in the period leading up to it, I always got the same question, which was, are there really homeless youth in Meriden? And it was always interesting to me because people either seemed to have an awareness of the fact that there really were kids out there in our community that needed a shelter or that needed services like Project Reach, the program that I was a part of, our street outreach program, or they just didn't see it. And so I had to be able to answer that. I had to be able to really talk about the need in our community and what that meant for us, and talk about the invisibility of the population, about the fact that they don't necessarily look like homeless adults, that people kind of have to get around what their stereotype is of homelessness, and really help people to understand, A, those stereotypes aren't necessarily true, but they're particularly untrue for homeless youth, and help to educate them about the fact that kids are often couch surfing and that they are still in need, even if you can't see them on the streets, or if they're not presenting to like the adult shelter or some of the other services, or even acknowledging that they're homeless. That was really critical to getting buy-in from the community and having folks recognize that, yes, a youth shelter really was important in Meriden and in our greater community. So some of the initial steps in starting a shelter program, both for us and kind of on a broader level, you need to look at what you have, your own capacity, I don't think at WFC there was ever a question that we wouldn't be a lead organization. This was something that we knew we had experience with the population. It was a good fit for us. It was certainly something that we had wanted to do for a long time and recognized that there was a need. We did need to look at, who else we could work with, whether they were formal partners on a grant application or just partners and folks that we could work with. And so, I spent a lot of time, as we do, forging relationships in the community and looking at things like the school districts and the McKinney-Vento liaisons and making connections with them, making connections with the Community Health Center for our local health care for the homeless so that we knew that we would have a resource for our kids, talking to other human services providers in our community so that when we needed them for our sheltered youth, that we would have those connections available, even if they weren't going to be partners for us. Of course, the next step was to really look at models and program design, and I know that we tossed around a lot of different ideas, and I can talk specifically, or I will talk specifically in a couple of minutes about the host home model. Generally, when you think about a youth shelter, most people are thinking about two models, one being a physical shelter location, and the other one being a host home design. They each have their own benefits, their own drawbacks, and so we really had to look at what those were, consider each one. I know we went through many, many different iterations of program designs, of budgets, and really considering what that would mean in terms of cost, in terms of staffing. I mean, we were talking about our first 24-hour residential program, and so that really was something new for us, even though myself and others in our organization certainly had that experience. It was a first for our agency, and we really had to consider how feasible that was and how feasible it was given the relatively limited amount of funding that we knew we might receive from ACF. The other thing we had to consider was licensing. We spent a lot of time, while we were preparing to write the grant, and then even after we got the grant, looking at what licensing would mean, what that meant for our ability to start the program, to keep it running, all of the different facilities issues, staffing issues that had to be taken into consideration with our licensing, and how that could potentially shape our program design, because it certainly did at different points really had an impact on what we were going to do and how we would do it. So ultimately, we chose a host home model. The host home model, I'll talk specifically about the benefits in the next slide, but just to give you an overview of what the program looked like, instead of having a physical shelter location, which we didn't have, although we certainly tossed around that as an idea of using existing space and that sort of thing, or even renting or purchasing something. But because we didn't have that available to us, and for some other reasons, we really felt like a host home was the way to go. Our program had 6 beds total, 2 beds per shelter home. A shelter home is essentially a private individual who looks in every way like a foster family. They are making their home and their family really available to runaway and homeless youth who need housing for a short period of time. The shelter parents, as we called them, provide all of the supervision and the support to the youth related to their day-to-day needs, incorporating them into their family routine and into their environment, and really provide that 24-hour staffing that the program needs. The program staff, I had a staff of 3 advocates, 2 part-time, 1 full-time, provided additional coverage for the day-to-day support. We were also planning to recruit volunteers for that purpose so that when folks were working, shelter parents were working, and kids were not in school, that we would have some care mechanisms built in addition, because we couldn't have the kids unsupervised. Our outreach staff, the 3 staff that I had and myself, would provide all of the case management in the program. And then we had 24-hour coverage for the program through a hotline. ACF requires, and certainly logistically, you want kids who need shelter to be able to access the services 24 hours a day, 7 days a week. We actually set up a cell phone for that purpose, partly for just logistically it being easier, not having to worry about an answering service and some of the pitfalls with that, and having kids hang up on an answering service, and not wanting to talk to someone. It makes it a little easier in the middle of the night for a youth to pick up the phone and get a staff person in the program if they do need shelter right off the bat. The other thing that we were recognizing was what we had seen in our program for a long time, which is the use of technology with kids. We set it up so that anywhere that our hotline number was publicized, it was also publicized that you could reach us by voice or by text, because we know that our kids are much more likely, even in a crisis, to text someone if they have that option available to them. So that made it really nice that youth could reach out to us when they needed it via text and then get a call back or even have a text conversation about their needs. Myself and the senior outreach manager were the folks who were actually manning that hotline and carrying that phone around with us. Other pieces of the program design that we had, ACF mandates that there is a 21-day length of stay. It is a very, very short-term program when you're dealing with runaway and homeless youth. Really the idea being that you have a kid who's in crisis, they need to be sheltered, and they need to very quickly move from that crisis into a safe and stable living environment after they've been sheltered. So that 21 days is really a window to help stabilize them, do an assessment, really meet their basic needs, and then immediately work on a plan around where they're going next. Are they returning home? Family reunification is always the preferred step. If that can't happen, of course, we're dealing with kids who are under the age of 18, so we were always making referrals to DCF. Whether or not DCF, would get involved and would choose to take the case would certainly lead us in a direction as to whether or not the youth was actually going to go into shelter or go into shelter for a short time, or if DCF was choosing not to get involved, then we would actually shelter that youth. But that 21-day period is really time to provide some intensive case management and transition the youth back to their family, to another safe and supportive living environment, or even to a residential or other type of program. We did serve kids who were ages 13 to 17. Again, ACF regulations say that you can't serve older or younger than that. We had mechanisms in place if we got referrals for kids out of that age range to refer them elsewhere and provide some intensive case management in the moment. In terms of the staffing and the program design, the shelter families, like I said, look like foster parents. In Connecticut, the Department of Children and Families licenses programs like ours to be a child placing agency, meaning that they are, you as a provider are licensed to do all of the necessary background checks, screening, recruitment of foster families. In the same way that if you were running a foster care program or doing adoption services, that you would provide those services. So for all intents and purposes, our shelter parents were foster families. We just had a different name. They were providing a little bit different nature of services, and that this was very short term, and they knew that the kids wouldn't be with them for a particularly long time, and that it was a very specific population of youth that we were working with. So in recruiting and screening our shelter parents, we were doing a home study. We were doing extensive background checks, criminal record checks, several references, all of the sort of standard stuff. We would do safety things in the home, look at all of the facilities that our kids were going to be living in. Did they have adequate space available in terms of an extra bedroom? Did they have a bed? That sort of thing. And then once they had come through that process and were cleared to go ahead and be a shelter family for us, we also did extensive training with them, first aid, CPR, medication administration, of course, and then a lot on the dynamics of runaway and homeless youth, counseling skills, working with kids who are traumatized, essentially to take someone in the community who didn't necessarily have experience with this specific population, although we did really recommend that folks have some experience with at-risk youth, not necessarily a requirement, but some experience would have been nice for our shelter parents, but really prepare them to have these kids in their home and to understand what that population looked like. In terms of staffing, we actually shared our program staff with the street outreach program. This is not uncommon in the world of ACF-funded programs. ACF really looks at their funding as seed money. They require a 10% match for those funds, but they're really looking at as their federal funding as monies to get your program up and running and to support the basic functioning of the program. And so a lot of the providers have more than one ACF-funded program and will share staff in between them. So my 3 folks and myself, we're providing both the street outreach services and conducting street outreach on an almost daily basis. I, of course, was providing the program oversight, and then our advocates were doing the case management and a lot of community outreach. And each had very tailored roles, accordingly, so that we could divide things out. The case management services are really an essential piece of what is provided in any shelter, particularly in the host home model, though, because you have the shelter parents who are providing the daily care and support, and then you have a really different role for those case managers, or as we call them, our advocates. Our advocates were doing an assessment and an intake initially, as kids came in the door, really looking at what their needs were, and then immediately doing planning with them around what the next step would be from there. So where were they going? What supports did they need? How can we get them there? And assessing their needs and planning accordingly in their educational needs, connecting them with their school district, looking at if they were over 16, did they want to work? Was that a possibility? Could we help them with resume building, applying for a job, that sort of thing, looking at what supports they needed in terms of counseling, their medical needs, all of the different facets of their life. Our case managers really provided support around. So that kind of covers the basics of what our model looked like. The advantages of a host home model over doing a physical shelter that's in one location. First of all, it's a smaller program that creates a more home-like environment. And I think that was the thing that was really driving us in making the decision to go with a host home model program. Both my CEO at Women and Family Center and I had experience in residential settings, and we both kept saying that we didn't want something that looked institutional in any way for our kids. And it really came down on many levels to that idea that we knew by placing kids in what looked like a foster home that we were putting them in a really home-like environment that would allow for kids who had been in crisis to go into a stable family environment. They would have modeling of life skills, of positive behaviors. They would have that support that they might not have had where they came from or in their own family of origin. And so that really drove a lot of what we were doing. The other thing that is a huge advantage to this model is that it is, for many programs, a less expensive way to operate a shelter. For us, not having a facility that was readily available to us where we could open up quickly or without a lot of cost and expense involved in getting a facility ready or acquiring a facility, the host homes provided a huge advantage that we, rather than having to rent a facility or alter a facility or do something like that, we could engage with people who were in the community who had space available in their home, who were willing to take kids in. And rather than having to pay all of the associated facilities costs, we were offering them a monthly stipend. I think that was key. We recognized that we were doing something that was difficult for other providers to do, and that we know that it was hard for DCF to recruit foster parents. And so we really took that into consideration. What could we do differently that would make this more appealing? And I think that the sort of financial carrot of providing a stipend, whether or not the shelter parents had youth with them, really helped. We were providing them a small monthly stipend that just said, you're making your home available to us. You're available to us 24 hours a day, so that if it's 2 o'clock in the morning and I have a kid that needs shelter, you're agreeing to open your home. And that was part of their contract, that they would receive that stipend. If they had a youth with them, we also did a per diem rate to help offset their expenses, because, of course, teenagers, as we know, eat and use up a lot of your household things, and so we wanted to make sure that their expenses were reimbursed. The other benefit, I think, to a host home model is that it's easy to expand. We started with a plan for 3 homes. We actually opened with just 1 home, and we're still recruiting when I left. And to be honest, I'm not sure if they've recruited more at this point. But we also knew that if we were able to get more funding, we knew what it would take cost-wise and staffing-wise to open another home, and really recognize we could add beds relatively easily. So that was the other key advantage to this model. Other things to consider as you're opening a host home or any youth shelter program, just some theoretical issues. You want to consider positive youth development. It is a requirement for ACF programs that they take a positive youth development approach. It's really a theoretical approach that looks at the developmental stage of the youth and where they're at, and also incorporates a lot of youth control in their programming and in their services. So we had things that actually we were already doing, like having a youth advisory board, having kids involved in day-to-day decisions around the services that we were providing, like what kinds of recreational activities do you want to do, really looking at what kids were telling us their needs were, and being responsive to those needs. Trauma-informed care is another theoretical framework that you really need to consider. We really recognize the fact that that homelessness is a trauma in and of itself, along with the other traumas that our kids are coming with. A lot of the kids that we work with who are coming from child abuse, they may have experienced sexual abuse in the past, they may have experienced domestic violence, and so we certainly took a trauma-informed approach and incorporated that into all of our services. And I will talk specifically about some of the approach that we took in a minute. Safety issues are another thing to consider. You really want to think about and have a plan for how you will handle safety and how you will address that, make sure those plans are in place for your homes. And then outreach in the community really becomes critical to these programs. As I said before, having good relationships with providers in the community and with stakeholders really was key for us in terms of developing our model and looking at opening the program. But also you need to do that continued outreach to let folks know that it's available, to let the kids know that it's available. One of the things we certainly saw was word of mouth was critical to us, that kids tell other kids that there is something that's available to them, or that there are cool staff who are out there and you should meet this person or that person. So doing that outreach really is something that needs to happen continuously, both before and after you start the program. In our program, we did have a couple of special populations of runaway and homeless youth that we served. First of all, we were lucky at WFC that we also had the local sexual assault crisis program as part of the services that we offered. And in fact, prior to starting the shelter, I oversaw that program as well. And so we had that strong connection with our local rape crisis center. We also had a strong connection to our local domestic violence program. One of the things that we required of our staff in order to make sure that we were serving kids who had been victims of interpersonal violence was that all of our staff were required to be certified sexual assault crisis counselors and certified domestic violence crisis counselors, so that we really had some expertise and knew how to work with kids who were experiencing those issues. And we did see a huge number of the kids that we were working with, particularly through our street outreach program, and I'm sure as the shelter opened, who were experiencing those issues. The other thing that we added on when we opened the shelter program that was fairly unique was to really focus in on victims of human trafficking. When we were looking at the service area that we had, we knew that there was a particular area of our community, it's the Berlin Turnpike, which is a main thoroughfare in central Connecticut, is in the towns that are directly adjacent to Meriden. It runs through Berlin and Newington, and on the Berlin Turnpike there are a series of motels and hotels that are known for prostitution and human trafficking. And so we made part of our plan to actually address youth victims of human trafficking by adding specific outreach, both street and community outreach, to reach those youth victims. So it actually was something that started after I left, but the plan was to have our street outreach workers go out and start doing going out and doing street outreach to the Berlin Turnpike to actually look for kids and try to make contact with youth that are hanging around those hotels, around the convenience stores, some of the restaurants, that sort of thing, And then also to take the community outreach approach of talking with the proprietors of the hotels and motels, letting them know that we were available, leaving our information. Also, again, talking with the convenience store owners and other folks that might come in contact with those kids and let folks know in kind of a careful way that we were available. Of course, one of the things to consider when you're dealing with human trafficking is that you don't want to alert the Johns that you're out there necessarily. So our approach was really to kind of quietly start going into those communities and letting folks know that we were there. A couple of things to consider in terms of starting a youth shelter in your community. In terms of funding opportunities, ACF really is the primary funder in terms of federal funding. They actually just posted Basic Center and their transitional living programs. I think that they've just closed. It's certainly worth exploring whether you can find more localized funding opportunities in your own communities. I know that in Connecticut, DCF does fund opportunities periodically, provide opportunities to provide more services to runaway and homeless youth in terms of shelter. And then things for post-award startup, you really want to consider the timing. I think that if there's one thing that I look back on, we were in, even though 6 months seemed like a long time to start up the program, we definitely had a time crunch. You really need to make sure that you know your stuff around licensing and what's required. If you're going to do a host-home model, you need to allow extensive time for recruitment of shelter parents because it is difficult. I know we had a lot of interest up front, and I think all but one person dropped off initially, and then we did a ton of advertising, a ton of community recruitment, really letting people know wherever we could, and that process takes time. You also want to allow, obviously, for time to develop your policies and procedures, look at your staffing, get everyone trained and ready to go. So with that, I'm going to hand it back to Samantha and to Mark.
Thank you, Kristen. And I'm going to go ahead and quickly hand it over to Mark, our second speaker today. Mark is the director of the Lighthouse Training Institute in Cincinnati, Ohio. And today he will be discussing improving emergency housing options for older youth. Let me just get this passed over to him. And just a reminder, if you have questions, we've already started to have questions come in. I'm going to save all of the questions for the end, but please feel free to continue to send your questions in. I have a running list of things that we'll ask as soon as Mark finishes up with his presentation. Thank you. Mark?
Hey, thanks, Samantha, and thanks to the National Alliance for inviting me and taking the leadership in this issue. I'm here in Cincinnati, Ohio, not as hot as it was last week, thank God, but I'm the director of the Lighthouse Training Institute. I've been with Lighthouse for 30 years, and I ran our independent living program and for 21 years and ran our boys group home and was involved in our transitional living program and other services throughout that time. Lighthouse is a nonprofit started back in 1969, and we have about 400 employees and a budget of about $23 million. And we have foster homes, group homes, crisis shelter, street outreach services, independent living, transitional living, home-based services, correctional services, charter school, and our new shelter, which I'm going to talk about here today. Just for people that are kind of new to the field, there are two fields that are kind of going along at the same time, and we have been involved with both of these fields since they began. For us, independent living is preventing youth 16 to 19 in the child welfare system from becoming and remaining homeless, and for us, transitional living is preventing non-systems youth from remaining homeless. We've had a youth shelter since '72, and we added this new shelter just in October. But we are working with both of these populations, youth aging out of foster care and homeless youth, and some of them overlap. But we have been developing a series of transitions services pretty much since the get-go. We started the state's first youth crisis center back in the early '70s, and it was based in our downtown YWCA. And now it's funded by a Basic Center grant, or RHY grant, and other funding sources. But I want to kind of just give you a summary of some of these transition services because they're all connected to each other and they're all kind of connected to the shelter too. A big part of what we're trying to do is preventing youth from even becoming homeless in the first place. We have a year-round self-sufficiency training program that goes on for all of our foster youth. So any youth that's in foster home, group home, in our county goes through this training, and it's a 10-week 4-hour-a-day training, and we've noticed that the youth that go through all 10 of the sessions do better when they get placed out in their own apartments than youth that don't have the training. Our Youth Crisis Center has 24 beds, males and females, and it goes from 10 to 17, ages 10 to 17, and it sees about 1,000 youth a year. And we have youth that come to that crisis shelter that end up going into either a foster care program or group homes or even our independent living program. Our youth outreach program is a RHY-funded program that has a small team of social workers that go out and deal with, give out cards and talk to youth on the streets and get the word of mouth thing going. We have a van that says Youth Outreach Program on it, and let them know about our new shelter and day shelter too. Independent living is working with youth that are aging out of foster care, and we're trying to keep them from becoming homeless by placing them out in their own apartments while they're still in foster care and teaching them how to live on their own. And hopefully, if they do well, they can take over the lease on their apartment, or we get them into some type of subsidized housing situation. We have a SAMHSA system of care grants that provides 6 years of funding for to build a system of care with youth with mental health issues. So that is something that we are part of, and the Journey people were very happy to hear about the shelter because they knew that that was something that was really, really in need for older youth that had mental health issues. Our Emancipated Youth Program is $100,000 of CHAFE funding that is essentially our aftercare program for youth in foster care. And this is really part of homelessness prevention, because if we find if a youth shows up in our shelter or another shelter after age 18 and they were in the child welfare system, we can actually pull them out of shelter and provide housing for them in their own apartment for up to 6 months. Transitional Living is a Runaway and Homeless Youth Act and HUD-funded program. It has many different sources of funding, but it consists of probably 50 to 60 scattered sites. The numbers are changing all the time for males and females, and a lot of teen moms are in that program. And related to that is permanent supportive housing, HUD-funded program that we have been running a Shelter Plus Care program for years, and that's for young adults with mental health and chemical dependency issues, and that's a really super program for youth that have the long-term needs. Reentry is for youth it's a series of programs for youth that are coming out of the criminal justice system, and it involves employment and sometimes housing. And then we have a home-based and wrapped-around services division that's actually working with all of our with a lot of our programs that sends therapists into the homes of the youth living in their own apartments sometimes to try to keep them stable in there and not need to get into the adult mental health system or fall apart to get off their medications. Community management is a standalone program for sex offenders. It's about 10 to 12 youth in it. It's essentially independent living for sex offenders, and very intensive case management, but the whole goal is to keep, in a lot of communities, sex offenders are released from the correctional facilities. They can't return home, so they end up on the streets. And our shelter, the Lighthouse in Highland, was started and just in October, and it was always the missing piece. It was always something that we wish that we had had. And our CEO, Bob Meekum, and many others in the city have been part of what's called Homelessness to Homes project that's been going on for the last few years, and this kind of came out of that whole process. So why do we create the shelter? It's always been obvious that youth did not feel comfortable, young adults did not feel comfortable in our big adult drop-in shelter downtown. They had like 250 beds, and it was sort of like just a very chaotic place, a very useful, the port place was very chaotic, and the youth would get into it with the older adults and vice versa, and sometimes the youth would say they'd rather be on the streets than be in the adult shelters. So that was one of the reasons. The adult shelters, on the other hand, were always not that happy to see young adults, 18 to 24, showing up down there because of their limited life experience, their attitudes, sometimes their violence and aggressiveness. And the story goes that the day we opened the shelter, the drop-in shelter downtown, rented 2 vans and brought 2 vans full of 18 to 24-year-olds up to our shelter, and pretty much filled it up pretty quickly. The needs of young adults are often different from that of the older population. A lot of the young adults that show up in shelters really You know, they don't have long-term mental health needs. They don't have chemical dependency issues. They just need some type of adult assistance in getting their life together due to the things that happen to them. Lighthouse had already been connected to many of the services for youth and young adults who are part of their continuum of care, and have dozens of staff that are involved with all the other services. So people kind of knew Lighthouse as being the agency that works with the 18 to 24-year-olds. We already had a successful transitional living program, Shelter Plus Care, and the youth crisis shelter. So we knew a lot about the shelters. We knew a lot about transitional housing. We just didn't have that shelter. We had also been running a day shelter called Anthony House, and it was a skinny little house over by the University of Cincinnati that was open in the afternoons 5 days a week. And it was just amazingly popular. I mean, we had up to 50 to 60 youth there. And I would go over there to visit Tom Kern, who ran the place, and he would be, literally surrounded by 15 or 20 youth just standing around him, just, hey, Tom, can you tell me about this? Can you call these people? And, it was obvious that this was a need in our community, and that this is something that we really wanted to expand on. But it was a small place, and it was right in between two residential houses. It just wasn't a great location. And as I said, this is the Cincinnati Homeless to Homes plan, which you can download off the internet. Kind of gives you the bigger picture on this whole process. The challenges that we faced, obviously funding was the big one and still remains the big one. But our CEO, Bob Meekum, is just really good at finding money in lots of different places and winning the trust of the community. We had a really generous donation from a private family to buy the apartment building and renovate it. And then Bob had a piece together, funding with HUD, and I'll run down that list here in a bit. Location was also a challenge. You don't just drop a 28-bed shelter for young adults in somebody's community without them noticing it. So that took a while. It took lots of meetings and connections with the city and approval meetings and community meetings to finally determine this location. And I really think we chose a winner. It's right in the center of town. Not downtown, but the center of the whole city, and it's right on a major bus line, and has big apartment buildings on either side and a parking lot across the street. So it's not right in right in between two houses. Building design was a challenge, but what we did is we got all the people in the community that had been working in shelters. We consulted with Pat Clifford, who ran our adult drop-in shelter for 20 years, and got him involved from the get-go. And we visited places like Larkin Street in San Francisco, and First Place in Oakland, and Daybreak in Dayton, and learned from everybody else's experience. So we learned from the best out there. Getting connected and remaining connected to all the existing adult services so that they knew about us and we knew about them, and we could use them as part of our services network. And then also, remaining in contact with the child welfare system, because a lot of the youth that were showing up had been in the child welfare system and still could get services through that system. Staffing it, determining on who we needed to have, what type of mix we needed between case managers and house managers and that. And that's still a work in progress, but it's settling down. And then programming, just deciding what we're going to do with this this shelter, what kind of services we're going to offer, classes, workshops, what was going to look like on a day-to-day basis. And then finally getting the policy and rules together, and that, again, was the result of a lot of input from a lot of people that had experience in this area. Funding, we're getting United Way funding, I think at least four private foundations, HUD for money, funding for case management, City of Cincinnati General Services funds, block grant funds for the expansion of the lower level of the building, in the courtyard, Ohio Department of Development funds for operations. We have an amazing group of volunteers called Caring Cooks that prepares lunches Monday through Friday for all the youth in the shelter, and then city emergency solution funds. And that's a picture of the shelter. It's kind of towards the dusk hours, but it's brand new as of October, and really didn't open fully until January. The wing on the right was the main part of the building that was there, and then we added the left part of the building and the courtyard in the back. But it's a beautiful place. It's hard to believe that we have it. Key services, we have case management, 3 case managers right now, 12 single rooms, 8 double rooms, lots and lots of connections with existing community resources. The caseworkers either were people that had already worked in the field for a while or had been really well trained on existing existing services. Rapid housing and short-term financial assistance to get youth into housing through our TLP program and permanent supported housing program. We have a nurse that's there from the city health department 20 hours a week. Connections to employment services, education services, a whole bank of computers that are in the main part of the room that youth can use. Life skills and training groups every day from 1 to 2. Mental health and substance abuse screening. If a youth comes in and is using, we will try to get them hooked up with a service as soon as possible. Communication ongoing with other continuum of care services, in-shelter food services, and aftercare case management. The shelter also houses a resource center, and it's open 5 days a week from 9 to 2, Monday to Friday. And that offers GED classes, counseling, job coaching, benefits enrollment, food, clothing, access to computer and phones, physical with a nurse, and any type of referrals. And a lot of youth use the center just for the resource center. They can be street youth that don't want to come in off the streets, or they can be people that are on the edge of a crisis, and the resource center keeps them from getting into a housing crisis. So that is just a really nice addition to this whole continuum that we have. Safety is a big part of the whole process. Making sure that people only get in that need to be there. A lot of time in the orientation is spent on expectations. You can't bring weapons in here. You can't make threats. You can't put your hands on people, and just letting people know that this is one thing that will get you removed from the policy, from the location. Right now we have a full-time program director, a house manager, a resource center coordinator, 3 case managers, several youth workers, lots of volunteers and activity partners, and a registered nurse. One of the things I think is really you want to set this up so that you screen in rather than screen out, and you can't expect people to be 100% ready for this when they come in and 100% cooperative. The good thing about the resource center is people can come in and check us out, go back out, and get to know us and build some trust. A lot of people on the streets have, just lots of trust and attachment issues, and they don't know what they're dealing with Lighthouse for a while, and they can kind of feel us out through the resource center and then come in and say, I think I'd like to stay here for a while, and then we can really work with them on a longer-term basis. Working with transgender youth is something that we spend a lot of time with our new staff on, and making sure that everybody understands where they get housed in the shelter, and how to deal with certain presentations and things like that. We do send youth in mental health crisis to our psych emergency services, and vice versa. They send youth coming out of the services to our shelters, so we have real good relationships with our local hospitals. A key concept in running a shelter, safety first for staff and youth. That's got to happen. We've done real well. I think we've had the police there 6 times since January, so that's really good. And a lot of times it's just to kind of calm somebody down. The whole harm reduction versus zero tolerance. These youth are going to come in and they're going to be using and doing all kinds of things that we don't want them to do, and as I said, we're going to screen them in versus screen them out. Really starting where the youth is out, individualizing services, and trying to find out what they need. Offering, not requiring services. If you come in here, you don't have to do everything that's there, but we can let people know it's available and let them take it as they need it. And then really keeping in contact with all the other services out there. Since January, we've had 115 intakes. The average length of stay up until June was 27. It's going down a little bit in the summer. 50% of the youth so far have left into housing, our transitional living program or permanent supportive housing. Slightly more females than males are coming in, and no on-site arrests so far. That's really good. And 85% maintain or increase their income. So Samantha, I think we're kind of running out of time here.
We're running a little bit low, but go ahead and do your last slide.
Okay, lessons learned so far, and this, there's so much more to this. But if you build it, they will come. We filled that place up probably the first week, and there is a waiting list from what I understand. And I think as more and more people find out about it, not only the youth through word of mouth, but the service system is going to become just a really good part of our crisis prevention system in this county. I think the police, when they find out about it, they will be dropping youth off, and it's really, really going to serve a purpose. Some youth only want the day shelter, and we don't force them to spend the night there. We let them kind of take us at their own pace. Use consultants that have worked in the adult shelter system to help you plan the youth shelter system, the young adult system, because they have been dealing with the youth, for better or for worse, for years. Just endless preparation and training and support of staff, making sure that they have everything that they have and that they know how to deal with the youth that are coming to them. We don't have shelter for teen moms and children. We use the family shelters and maintain contact with them, and vice versa. They send pregnant girls to us sometimes. Some youth need to go to psych emergency services. You can't expect the shelter in the resource center to deal with some of these crises that they present. Working on keeping youth from congregating nearby is something that we're going to have to keep an eye on, because there's a Taco Bell 2 doors down and a big parking lot across the street, and a lot of the smokers like to go over there. And that's one of the things we worried about with the shelter, just having the neighborhood worried about congregating youth, so we have to keep an eye on that. A lot of that just means walking down the street and saying, hey, you guys want to come in for a while. It's hard to find housing for youth that come in with major legal issues, and if they come in and they have outstanding warrants, we have to tell them that you need to get that taken care of before we can help you. Placing transgender youth with their identity group, that's something that we agreed on from the beginning, and that seems to be working. And right now, there's really no long-term funding for shelters. This is something that there's just a handful of people around the country that are doing this, and most of us are piecing together shelter from multiple sources of funding, and we really hope that somewhere along the line there's some more long-term things like the Basic Center program that RHY runs. All righty.
Okay, great. So I'm going to go ahead and get started in the question and answer session, and I know we're running a little bit late. We're probably going to take about another 10 minutes. We already have a queue of questions, but I'd like to remind participants that you still can send in questions if you want to. Type them into the chat box on the right-hand side of your screen. I'm going to do my best to get to the questions as quickly as possible, and I'm just going to ask Mark and Kristen to be as concise with your answers as possible so we can try to get through as many of the questions as we can. I'm going to start with a couple of questions for Kristen that came in during her presentation. Kristen, with regards to the shelter families, can you talk a little bit more as to how you went about recruiting them, and then also what the stipend situation was? So how much was the stipend that you were giving them?
So I'll give the very brief answer first, which is that it was a $500 a month stipend. And then I think our per diem rate was somewhere in the neighborhood of $17 a day. Again, that per diem rate was any time that they had a youth with them just to reimburse for things like food and household supplies that they were using. In terms of recruitment, I think if there was one significant challenge that we had, it was certainly recruitment. We also anticipated that early on. We really recruited to anyone who would listen to us. We did newspaper advertising, which I can tell you was not particularly successful. We sent out a lot of emails and things to all of our contacts. That certainly was successful, particularly with folks who had volunteered with us in the past, who were familiar with our agency. That word of mouth kind of advertising really helped. And then the other thing that I spent a lot of time doing was sort of going on a speaking tour about our program. And the purpose of that was twofold. One being to, just introduce the program to the community as we were getting ready to start it, but also recognizing that I never knew when I was going to hit on the right person who was in the human services field, maybe working for another agency, or we even started to speak to like Rotary clubs, to Kiwanis, that sort of thing, the local organizations in town, community meetings. I remember going to, like, in Middletown, their North End Action Team, where there was a group of community members gathered and doing 10 or 15-minute presentations on the program, and also on the fact that we still needed shelter parents and volunteers. So really a broad approach to getting word out.
Okay, great. Thank you. The next question is still in regards to the shelter parent sort of situation. And this is, I think, specific to sort of the certification portion of what you did. And the question is, are the host homes licensed or certified? And along with that, can you just go over a little bit more in depth the process by which your organization was able to pretty much certify foster parents, but in which case you were using them as shelter parents?
Yeah, so we were licensed by the Department of Children and Families in Connecticut as a child placing agency. DCF handles that licensure, or the process of recruiting foster parents or utilizing foster parents either directly through their own system of foster care or through community-based organizations. And when those community-based organizations do it, they have to have a license through DCF as a child placing agency. A child placing agency really means that you have all of the processes set up that meet DCF's requirements around recruitment, screening, training, and supervision of foster families. Again, I think this was probably one of 2 programs in the state that looked like this, so it was something that was relatively new to DCF as well in terms of utilizing the foster parents the way that we were. But that process, folks weren't licensed or certified by us. They were considered approved by us. So they actually went through a process of meeting all of the DCF requirements to become a foster family. So they had to go through background checks, criminal record checks. We had to do a DMV check. We checked with the sex offender registries, with the child abuse hotline for background checks on any charges. We did, I think it was 5 references that we had to check. We did a home study, the same kind of home study that, again, you would go through if you were applying to adopt or do foster care, and that covered everything from your own personal history with your family life, your philosophies on parenting and child rearing, what does your family look like, what is your home set up. We had to deal with facilities issues like, if they were in a rural area, getting their well water tested, if they had a fireplace, having that inspected, of course making sure that there were things like fire alarms in place and safety plans for all kinds of health and safety needs. And once folks had completed all of those requirements and met them satisfactorily, they were approved by us to serve as a shelter parent. DCF, this was something important for us to note, is that DCF does not allow a provider to hold more than 1 approval at a time, meaning that you can't serve as a shelter parent for us and then also be a foster parent for another organization. It's just one of those approvals at one time. But that was the process in a nutshell.
Okay, great. One last question for Kristen, and then I have a couple for Mark, and I'm going to try to go through them quickly and wrap everyone up by about 3:10, just so everyone knows. Kristen, you stated that you have a cell phone where you can get in touch with you to do intake basically in the middle of the night. How do you do intake in the middle of the night without a physical location for the youth to go to sleep?
What we were doing, and I have to say this is a little bit theoretical because I left the program so shortly after it started, but what the plan was around that was that if a youth contacted us via the cell phone, we would really assess their situation and what their needs were in the moment. And first of all, make sure that they were currently in a safe location. And if they weren't, of course, get them to a safe location if it meant us going to them. But essentially what that involved is as soon as we picked up the phone, we were going to do a brief assessment with that youth to find out what was going on for them and what their needs were, what the crisis looked like in the moment, and really assess what needed to happen right then and there. Ideally, what we would do was make sure that that youth was temporarily in a safe place and then make arrangements to meet them in the community, or if they were with someone that was capable of arranging for transport or transporting them directly to the shelter home, we would actually just meet them at the shelter home, get them settled, and then depending on the hour, the circumstances, that sort of thing, we really want to make sure that their basic needs are met, that they are comfortable in the shelter home, and then either start the assessment process or give them some time to settle in, sleep, get some food into them, and start that assessment from there. But we did have a policy that we did at least their initial assessment within their first 12 hours because you really do need to, find out what's happening for that young person right off the bat.
Okay, great. So Mark, I have 3 questions for you, so keep that in mind when you answer. The first is that a lot of people have written in and just said, creating an entirely separate building for 18 to 24-year-olds is just not feasible in my community. For people who are in that sort of situation but want to make their adult system more responsive, what are some of the lessons that you've learned from having the 18 to 24 shelter that you think might translate well into the adult system?
Well, I think you just want to be very much involved with the existing adult shelters and with the local continuum of care and the homeless coalition providers in your area. Just to talk to them about what are the possibilities. We as Kristen has talked, we actually use the host home model every now and then in independent living for older teenagers, and that's something I think that I would look at if we didn't do this way. But I think you really, people that just say that this isn't going to happen. I think what it is we said that for years that it wasn't going to happen, and now it's there. So I think you should never give up. And I think that if you don't have a local homeless coalition, create one and you'd be surprised how many people want to become part of that, because business people and the police and everybody in the hospitals, everybody knows that there needs to be services for this population. The private sector, just foundations and just people out in the public are aware of this problem, and you can actually get people to. We've had houses, apartment buildings donated to our independent living program. So there are ways to make this happen much more than you might think. I think working with the child welfare system to try to find out ways to keep those youth that are coming out of that system from becoming homeless, because that's one of the big feeders into that, and working with the adolescent mental health system to also work with them to make sure that youth aren't just spit out on the streets without any type of services. But the day shelter, I think, is another really fun thing to think about, because I think it's something that you can operate and get up and running pretty quickly. It doesn't involve all the stuff that an overnight shelter would have.
Okay, great. And going along sort of on the same vein as what you just ended with, a person wrote in saying that they have a center right now that's for 18 to 24-year-olds that runs from 6 to 9 p.m. and they have dinner and showers and laundry and clothes. It sort of sounds like a nighttime day center, but it's not an overnight. They have a huge need for shelter. Is the first logical step for them to take it to a day center and then move to an overnight shelter, or should they just make the jump right away to an overnight shelter?
I would make the jump.
Okay.
That's what I would do with that. But I think it really depends on the community. I think that it is interesting, because that 6 to 9 time slot seems to be in some ways a better time period for the shelter to be open than the afternoon. But I would just try to go right into the overnight shelter. That's what I would do.
Okay, great. The last question for you, Mark, is that you stated that 50% of the youth that have stayed in the 18 to 24-year-old shelter leave with housing. And can you expand a little bit on where those youth are going in terms of, are some of them moving into their own apartments independently, transitional housing, permanent supportive housing, and sort of what the spread is between those?
I don't have the exact numbers, but since we've had our own existing transitional living program since 1989, we have just a real wide range network of landlords all over the county that we can use. So we're able to get youth there pretty quickly. And we're pretty much converting our shelter plus care into a permanent supportive housing. So we have funding for that too. So we had 2 different funding sources plus different HUD supportive housing services support that we were able to use the scatter site model to get youth out as quickly as possible. If that was not if we were filled up, then we used other types of subsidized housing, or we found places, family members that were willing to take the youth into it so that they could get into our programs.
Okay, great. And with that, I have to, I'm sorry, conclude our webinar. I'd like to thank both of our speakers, Mark and Kristen, again, and remind that all of the participants of this webinar will be available on the Alliance's website as soon as possible. And the link to the webinar recording will be sent out to all registrants. Thank you all again for joining us, and I hope you all have a great rest of the week and a great weekend. Thank you, Mark and Kristen.
Thank you.
Thanks, Samantha. Thanks, everybody.